we're going to be going over a composite tray setup and what instrument is used for. So first, you're going to start off by greeting your patient, welcoming them into the office. And then after, you're going to go over the health history form. Make sure there's nothing new, no new medications, allergies, surgeries, anything. Any questions they may have missed, any questions they have, go over it, make sure all is well. If anything is new, you're going to inform the doctor, of course. And then after that, you're going to explain the procedure. It's a composite tray. Let them know what's going on, what's going to be done today, what tooth, all that. And answer any questions they need. If not, you're going to have them sign a consent form. And after the consent form is signed, you're going to make sure there's a recent x-ray. If not a recent one, you're going to verify with the doctor that you do need a recent one. And after the x-ray is taken, you're going to take your topical anesthetic and your cotton tip applicator. Right there, your cotton tip applicator, your topical anesthetic, and you're going to go ahead and numb around the gum area where the shot will be placed. And after that, the doctor will come in and get the syringe, the carpule, and the needle, and he'll go ahead and numb the patient. And as the patient is numbing, he'll probably go run around the office, do other things he needs to do while she's numbing for a certain amount of time. He will begin to prep the tooth with a high-speed handpiece right here. And sometimes if there's a lot of decay, we'll use a slow-speed handpiece. And if you're not sure if all the decay is removed, you'll use a spoon excavator to scoop out the remaining decay. Then we will place a rubber dam sometimes to isolate the tooth. Once the tooth is isolated, we're going to go ahead and place a Tafelmeyer and matrix band right there. And sometimes there's a clear matrix band so we could cure through it with a light. But we're going to go ahead and place that. Now we are ready to work. We will place the goggles on the patient to protect them from the cure light. And once the goggles are placed on them, we're going to begin working on the tooth. We're going to use an acid etch. It's going to remove the smear layer of the tooth, like tooth dust, saliva, water. The tooth has to be clean to ensure the composite will stick and stay on the tooth. Once the doctor gives you instruction to rinse, you will rinse with the air water syringe. And have the HVE to suction all acid etch, saliva, and water. Now the doctor will apply the bonding agent. The bonding agent you apply with a micro brush or a lint brush. He will dip into the material painted onto the patient's tooth. Once placed, doctor will begin to dry and make sure that it's a thin layer. Then we will cure it for 10 to 20 seconds. Now we are ready to place the composite material. We will squeeze it onto the tooth or onto a mixing pad. It depends, because some are thin, you could just squeeze on the tooth, and some are super thick, so you want to place them on a mixing pad to mix in. The doctor will grab it as he pleases and as much as he wants. Then he may use a beaver tail. A beaver tail or a burnisher, it's up to the doctor to go ahead and brush around it, smooth around it, do all he needs to do. And when you're putting on the composite, you're going to do it layer by layer, not all at once, because if you do it all at once, the cure light will not reach all the way through the tooth. So you're going to have to place some, cure, place some, cure, and just keep doing it until he pleases. And once it's filled, the doctor will shape the filling to match the current teeth. Once hardened and cured, the doctor will remove the matrix band and he will then he will shape it with burrs or sandpaper disc. After, the doctor may use a finishing strip to help smooth the filling. Then he will check the bite. To make sure it's not overfilled. And if it is, he'll go back and fix it up. Then we get a floss check. We check it with the floss to make sure the contact is correct. Then we will give the patient post-op instructions. Do not eat or drink until you are no longer numb. You can eat after it wears off. You may experience cold or heat sensitivity, but it should be no throbbing pain. If it lasts longer than a week or two, call the office immediately. Then you release your patient, and that's it.